This is a chest x-ray. But what's the point of it? X-rays are a form of radiation, just like light waves or radio waves. They can be used to create an image anywhere in the body to help doctors understand what's going on inside. A chest x-ray is a quick, cheap and widely accessible test that doctors can use to get a clear image of your heart, lungs, blood vessels, airways and bones. Chest x-rays are useful for diagnosing new conditions, but also monitoring existing ones to see if they're getting better or worse. X-rays don't make you feel a thing, although you might absorb a little bit of radiation. However, the benefit far outweighs the risk if a specialist chooses to perform one. Make sure to follow to see some examples of interesting x-rays that don't look normal. You've probably seen a chest x-ray on TV, but what are doctors actually looking at? Well, first, I quickly have to tell you how it works. You place a device that gives off x-rays through someone's chest, but the person doesn't feel anything. On the other side of the body, you have a detector, which catches those x-rays and turns it into an image. The x-rays really struggle to get past the dense parts of the body, like the bones for example, which makes them appear white on the image. The air in the lungs allows x-rays to go directly through them, making it appear black. And all fluids or soft tissue in between come out as some sort of shade of grey. This is a chest x-ray of a normal person. Here you can see the ribs, the heart, the spine, the chest wall, and even the little airways of the lungs. Doctors could be looking for any number of things on a chest x-ray, so follow if you'd like to see some interesting medical cases. This is a normal chest x-ray, but look at this one. What is that right there? In a healthy person, the lungs should largely appear black, because that's what air looks like on an x-ray. But if for whatever reason you start to get blood, fluid or extra soft tissue in the lungs, you start to get patches of white. And although it's most likely going to be caused by a chest infection or pneumonia, we can't call it a pneumonia yet because we don't know the full clinical picture. It could still be any number of things. Therefore, doctors have to be able to describe this finding on a chest x-ray without necessarily putting a diagnosis on it. That's why we call this patchy white stuff consolidation. Consolidation can also be caused by bleeding within the lungs, heart failure, or even cancer. Make sure to follow us for more interesting cases, and remember, X-ray quiz number 4. This is a normal chest X-ray. Can you guess what's wrong with the next one? You can probably tell that this side is a lot darker than that side. This is a pneumothorax, which is where the lung gets surrounded by air. But wait a minute, the lungs are full of air, right? So why is that a problem? The lungs begin with these big airways which break off into smaller and smaller airways and end with these small balloon things called alveoli. Now, as the lungs are constantly inflating and deflating within the body, they'd be rubbing up against all these other structures, causing friction and damage. So there's a thin layer of lubricating fluid between the lungs and the chest wall, reducing that friction. But there shouldn't be any air in that space. It's not helpful there. A pneumothorax is when air gets into space and surrounds the lung, meaning that the lung can't expand as well, creating this feeling of breathlessness. Sometimes this resolves on its own, but if it doesn't, a tube might have to be placed in this space to drain out the air. Make sure to follow for the next quiz. X-ray quiz number 2. This is a normal X-ray of the chest. Now look at this one. What do you immediately notice that's different about it? This little round patch of white shouldn't actually be there. It looks suspicious. So what is it? Well, right now we can only use descriptive words because it can still be any number of things. So we describe this patchy white stuff as consolidation. But let's find out what it actually is. A physician would look at this scan in the context of everything and all the symptoms that the patient complains of. For example, if they have a cough and they're bringing up phlegm, it might be a chest infection. But in this case, this patient may have complained of a dry cough, losing weight, feeling tired all the time, and maybe even sweating at night. This, my friends, is a lung cancer. A further CT scan along with other tests might be used to confirm the diagnosis and even the exact nature of the cancer. Doctors who specialize in looking after the lungs, along with cancer doctors, will then get together and decide on how to manage it. Make sure to follow for the next X-ray quiz. X-ray quiz number 5. This here is a normal chest X-ray, but what's going on in this one? Well, let's start by identifying the most obvious difference. This part here. We can describe it as consolidation, or a white patch, around the base of one lung. And what is it that sinks to the bottom of any container? Fluid. This is called a pleural effusion. The lungs sit within the chest and there's a thin space between them and the chest wall that is called the pleural space. This contains a thin layer of lubricating fluid which allows the lungs to expand smoothly without friction. And if there's an excessive buildup of fluid here, it's called a pleural effusion. This is obviously bad because it's taking up space that the lung needs, and so a person with this might feel very breathless. It can be caused by infection, heart failure, and even cancer. For the next quiz, make sure you're following the Hippocampus TV.